Welcome to this video on diagnostic biomarkers in Alzheimer's disease. We will provide a comprehensive analysis of PET, MRI, and CSF modalities. This video begins with an executive summary, highlighting the transition from symptomatic to biological definitions of Alzheimer's disease. The clinical imperative for a biological shift is driven by delayed diagnoses and the need for precision intervention with disease-modifying therapies. We are redefining Alzheimer's biologically. Traditionally classified as a clinical syndrome, the NIA-DA research framework now defines it based on specific measurable biomarkers, independent of clinical symptoms. The core diagnostic modalities evaluated are focused on detecting amyloid, tau, and neurodegeneration. Amyloid PET scans are the gold standard for visualizing amyloid beta plaques in vivo, confirming the underlying molecular pathology for an Alzheimer's diagnosis. Tau PET scans track neurofibrillary tangles, correlating strongly with the severity of clinical symptoms and cognitive decline, and serving as a powerful prognostic indicator. Structural MRI, or atrophy, measures macroscopic brain tissue loss. It is critical for an exclusionary role, ruling out non-neurodegenerative causes of cognitive impairment. CSF biomarkers, obtained via lumbar puncture, provide a direct window into the brain's biochemical environment, revealing low amyloid beta 42 and elevated t-tau and p-tau levels. The ATN classification system categorizes biomarkers into amyloid A, tau T, and neurodegeneration N to stage and characterize Alzheimer's disease. Biomarker ratios, specifically the A-beta 42, A-beta 40 ratio, enhance diagnostic accuracy by normalizing for total amyloid production. A lower ratio strongly correlates with cortical amyloid deposition. This modality comparison matrix summarizes target pathology, invasiveness, cost, and accessibility for amyloid PET, tau PET, structural MRI, and CSF biomarkers. We now turn to emerging paradigms, focusing on the revolution of blood-based biomarkers, or BBMs. Blood-based biomarkers offer a minimally invasive, highly scalable, and cost-effective triage tool for primary care settings, with accuracies approaching CSF analysis and PET imaging. The economic burden is significantly lower for blood-based biomarkers, driving massive investment as they offer comparable diagnostic insights at a fraction of the cost of traditional PET imaging. The adoption of fluid and imaging biomarkers faces hurdles like high costs and reimbursement issues, accounting for 40% of the barrier. A lack of infrastructure and a shortage of specialized clinicians are also significant factors. The biomarker evolution curve illustrates the progression of Alzheimer's disease. Biomarkers become abnormal in the preclinical phase, 15 to 20 years before cognitive symptoms appear, enabling early intervention. We now examine the clinical translation of these biomarkers and their significant impact on trials, treatments, and patient care. Biomarkers improve clinical trials through patient enrichment, ensuring only those with confirmed pathology are enrolled. They also verify target engagement, provide surrogate endpoints for drug approval, and facilitate prevention trials. Global biomarker testing volume is projected to scale exponentially through 2030. This growth is driven by the approval of disease-modifying therapies and the commercialization of highly scalable blood-based assays. The future of precision neurology involves integrating PET imaging, structural MRI, and high-throughput fluid biomarkers to transform Alzheimer's into a treatable disease.